Now let us see the thoracic wall pertaining to the dissection. This is the thoracic wall. Now the intercostal spaces are 9 in number on the anterior side. Posterior side they are 11 in number. So we have 9 anterior intercostal space, 11 posterior intercostal space. Intercostal space contains intercostal muscle, intercostal blood vessels and intercostal nerve. Now let us see here on the anterior side. This one is the sternum. These are the ribs. Here one is the sternal angle from where we can count the ribs. This is the second costal cartilage and this one is the second rib. So this is the second intercostal space. This is the third intercostal space. Now we can see here the white shining structure. This is the external intercostal membrane. This is the external intercostal membrane. Now posterior to the external intercostal membrane, what we can see here, the fiber direction opposite to the external intercostal membrane. These are the muscle fibers. These are the muscle fibers of the internal intercostal muscle. Internal intercostal muscle, posteriorly it is replaced by the internal intercostal membrane. Here the external intercostal membrane, that is replacement of the external intercostal muscle. The fiber direction is downward, forward and the medially. Now we have cut the sternum and the lateral aspect of the sternum and the ribs. Now we can see this one is the anterior part of the inferior mediastinum. The mediastinum, that is the space between the two lungs. The space between the two lungs, that is the mediastinum. Here we can see this is the inferior mediastinum. Inferior mediastinum, it is divided into the three parts. Anterior mediastinum, that is a slit like space. Then the middle mediastinum, it contains the heart, and posterior to the heart, that is the posterior mediastinum. This is the right lung, this is the left lung. Now the heart and the lungs, they are covered by their covering. The covering of the lungs, that is known as the pleura. This one is the parietal layer of the pleura. The visceral layer of the pleura, it is a single cell layer thick and that is attached to the lungs. It cannot be separated like this parietal layer. So the space between the parietal and the visceral layer of the pleura, that is known as the pleural cavity or the pleural space. Now this is the heart outline, and here you can see it is covered by the pericardium. So this is the pericardium. Now when we cut the pericardium, we can see the structure of the heart. The pericardium has two parts, fibrous pericardium and the serous pericardium. Serous pericardium, it has two layers, visceral and the parietal layer. Now here when we cut this pericardium, the pericardium, the diaphragmatic surface of the heart, which lies on the central tendon of the diaphragm, where this pericardium is fused with the central tendon of the diaphragm. So we can enter and we can see this is the heart along with the various outlines, and the yellow color, this is the pericardial fat which is covering the heart. It is also the visceral fat. So this surface of the heart, what we can mark out from the anterior side, this surface of the heart, that is known as the sternocostal surface of the heart. This is the site of the apex of the heart. This is the apex of the heart. On the upper part, this is the site of the aorta. Aorta, here it has the three parts: ascending aorta, arch of aorta and the descending thoracic aorta. Now the arch of the aorta, it starts at the level of the sternal angle and the ends at the level of the sternal angle. So we can correlate this level internally. Now we can clearly see and take out here. Now on the lower side, here it has the opening in the right atrium of the heart, that is of the inferior vena cava. Now let us cut this inferior vena cava. I am cutting the inferior vena cava. The vena caval opening, that is in the diaphragm. The vena caval opening, inferior vena caval opening, it is in the diaphragm. It is situated at the level of T8 thoracic vertebra. This is the venous blood here. So we can see here the vena cava opening, inferior vena cava, which is opening into the right atrium of the heart. So this is the right atrium of the heart. It is, muscles are thin on the atrium compared to the ventricles. Now this one here, focus on this. Now this is the central tendon of the diaphragm, where we can see this is the pericardium. It is fused to the central tendon of the diaphragm. The heart lies on the central tendon of the diaphragm, thoracoabdominal diaphragm, and this is the pericardium. It fused with the central tendon of the diaphragm. So this surface of the heart, that is also known as the diaphragmatic surface of the heart. The surface of the heart, that is known as the diaphragmatic surface of the heart. So again I am repeating, the space between the two lungs, that is known as the mediastinum. The space in which the heart lies, it is the part of the inferior mediastinum, and that is known as the middle mediastinum. So heart is one of the content of the middle mediastinum. The superior mediastinum, it contains the blood vessels, great blood vessels, which are situated at the base of the heart.